Hello, my name is Monica Young, and I'm a general and bariatric surgeon here at Capital Medical Center. So I'm originally a Pacific Northwest native. I grew up in Portland, Oregon, and I traveled away for about 8 years to Indiana to do my undergraduate and my medical school. And then I circled back to the West Coast, ended up in California for 6 years for general surgery residency, and did my final year actually at Seattle at University of Washington for my fellowship. So when I finished my training, it just so happened that there was a community hospital in Olympia, Washington that was looking to hire a general surgeon. Timing worked out perfectly, and I was really excited to be able to stay in the Pacific Northwest. Actually, the way that my practice developed, because I'm the only female surgeon in the group, is I have performed a lot of care for breast cancer patients over those years. And in addition to that practice as a bariatric surgeon, I quickly realized that there was very little access to bariatric surgery services in this area. In fact, the closest program was in Tacoma, so a lot of people were driving all the way to Tacoma to get those specialty services. So I also created a bariatric surgery program here at Capital Medical Center. We had a little bit of a delay due to COVID, but we became accredited as Thurston County's first bariatric surgery center of excellence in March of 2021.
Hi, I'm Will Calicote. I'm the president here at MultiCare Capital Medical Center and the Thurston County market leader for MultiCare. Dr. Young has done a lot for providing care in this community. Obviously, a lot of providers refer patients to Dr. Young. Dr. Young is a general surgeon, bariatric surgeon, breast surgeon, and so she actually provides quite a bit of care in the community, but it's really what Dr. Young does in her off time. And Dr. Young did quite a bit in pulling together. Last summer, she pulled together a women's community advisory committee and got them in a room and asked for their input on what care do women need in this community and what's going unserved.
Hi, I'm Cecilia Lovelace. I'm the Executive Director of MultiCare Capital Pacific Regions Foundation. I first met Dr. Young just about a year ago when she was sharing her vision for women's health and establishing a state-of-the-art women's health center for our region. And I was so moved by her ambition and her love for women and her ability to go well beyond herself, to listen to hundreds of women throughout our region and listen to them sharing about what their healthcare needs were. I was very inspired and willing to give any and all of my time to help support this vision that she had. And we established the Women's Community Advisory Council, and at that event, she kicked that off, leading that effort by sharing all of the opportunities within women's health for women and educating all of us on what those could be and could look like. And then she sat back and she just listened to all of these women.
And now all of those ideas and that vision have come together, and there's actually a first phase of the Women's Health Center that's opening next month, and it's going to be located immediately behind Capital Medical Center. In a few years, we're hoping to then move on to phase 2, which would be a freestanding center for women's health, which would involve primary care, it would involve a comprehensive breast cancer care center, and also a pelvic floor center.
I think when you think about community impact, you think about someone who goes above and beyond, someone who gives more of themselves than they need to. And oftentimes it's hard to find those people that want to go above and beyond. And Dr. Young has gone above and beyond for women's health in our community.
I'm just really privileged to have her on the team. MultiCare Capital Medical Center is doing a lot to grow services and expand care and be more relevant in the community. And to have her on the team, it just adds that extra horsepower that needs to get that done, and she's just a great advocate.
Well, I do want to say that I really do share this recognition with all the other people that were involved on the committee. Certainly I want to thank Will and Cecilia from the leadership team, as well as all the women who participated, gave their time and their energy to be involved in this project. I'm really excited to see how it's going to continue to develop and to see how the phases are brought to life in the next few years.